So here's the third symptom, disc herniation or a bulging disc. Now a bulging disc is sort of a prerequisite to a disc herniation. And that's sort of the easiest way I can describe it. So a disc herniation, a rupture of the fibrocartilaginous material that surrounds the intervertebral disc. So that's all quite wordy, and I wanted to put that up there because that's sort of the definition of what it is. But also what I want you to do is I don't want you to be intimidated by these big long words. Is as long as we can understand those big long words, it can be very easy when we are speaking to another professional, a doctor, whatever it may be, we can sort of in a way hold a conversation with them, which shows that we have some degree of understanding of what they're talking about, which then sort of creates for them sort of an empowered patient, if you know what I mean, because you're able to hold a conversation with that. They don't have to, in a way, sort of dumb it down for you. And it's all good understanding sort of the layperson metaphors and ideas, but I think it's a good idea to sort of understand the sort of the more technical scientific words, because then it helps you, help you understand who is a good professional and who is maybe a not so good professional who just wants to give you a load of jargon that maybe you don't understand, that possibly they don't understand either. So enough of that. Disc herniation. So as you can see on the picture on the left hand side, you've got a bird's eye view of two discs. You've got a normal disc and you've got a herniated disc. You've also got two colours. You've got a light pink and you've got a dark pink. Now the light pink is a gel. It's like the gelatinous fluid on the inside of the disc. What you've then got is the darker pink, which is the fibrocartilaginous material, so the wall that surrounds that gel. Now it's the gel that gives the disc its ability to change shape, and it's the wall that sort of holds the gel in place. Now a herniated disc is when that gel ruptures through that wall. So the light pink colour breaks through the dark pink colour and it touches the nerve, and that creates the pain. Now that's a herniated disc. A bulging disc is where it's nearly going to break through and the actual disc is touching the nerve rather than the fluid. So it hasn't fully ruptured, it's just bulging. Okay, so we've got a herniated disc and we've got a bulging disc. The herniated disc and the bulging disc is where the gel starts to break through that wall, and then eventually either the gel will touch the nerve or the disc will bulge onto the nerve, and that will create a pain. If we then look to the picture on the left hand side, as you can see here, is we've got a flexed spine. Now if you can imagine, you've got your index finger on top of your thumb, and in between your thumb and index finger you've got a seed or a pip or something small in between there. Now if you push down on the front of that pip, where's it going to go? Well, it's going to pop out the back, isn't it? And that's the exact same thing that's happening with your disc. When you flex your spine, you are pushing that gel towards the back, and it's that flexed position that is creating the extra pressure that is creating the disc herniation. So if I can just bring you down onto the little definition or phrase or quote on at the bottom of the page, you've got disc herniation is associated not only with a deviated posture, which is what we talked about earlier, either fully flexed or bent, again poor posture, but also with repeated loading. And repeated loading is the overuse and misuse of the spine. So we've got a deviated posture, which is fully flexed or bent, so if we've got a bent posture, but also repeated loading, which is overuse and misuse. So if we've got misalignment in other joints, that is going to create a repeated loading on the spine, which is what we were talking about earlier. So what we have to do is we have to correct the joint misalignments, correct the muscular imbalances, improve our movement, and what that will do, that will correct our posture, bring us into a neutral alignment, and that will reduce the pressure of the repeated loading on the spine. So the key to preventing lower back pain is creating a body that is aligned and symmetrical, not only in the joints but also in the muscles of the body as well. So if we are preventing low back pain, if we are preventing a disc herniation, we need to be able to do that. If we are in recovery from a disc herniation, what we'll need to do is we'll need to go see a surgeon, we'll then need to go and see a physio, and then it would be then coming on to the 7 steps, then coming on to improving the movement, because we can go to a surgeon, we can go to a physio, and we can treat the problems, but if we don't correct the movement that created it in the first place, eventually the herniation will come back, or the back pain will come back again, because where we've been treating the symptoms all the way up through, we've never addressed the cause, which is the deviated posture or the flexed spine or the repeated loading. So what we have to do is we have to be able to, at some point, correct the cause, which is the overuse and misuse of the human body. So what we're now going to look at is pain itself. So what is the pain? Because a lot of people think the pain is bad, but we're going to explain that maybe the pain isn't so bad. It's maybe doing us a favour rather than a hindrance.